Hey guys, it's Dr. Lisa in Tampa, Florida, where we are coming in day to day, handling a huge primary care practice and navigating through the COVID-19 pandemic. Thanks for joining me. Anybody new who's here, we appreciate it. Please feel free to share the information. What I've been doing is just trying to get you some updates on interesting science, followed by a practical tip and then an affirmation. So the interesting science for today about COVID-19 is just the concept of how this virus works. Really interesting in that semantics tell you that it's not alive. It actually requires our cells to do damage. So what most of these type of viruses do is they go into the body and then they enter your cells and kind of hijack the genetic making material and wreak havoc. So that is why you can inactivate this virus by scrubbing your hands like we've talked about before, because the virus has an envelope around it that is made of fat, and it requires that fatty envelope to get inside the cell to get activated. So when you scrub with soap, just like you clean your pots and pans and it cuts grease, it cuts the fat, and then that fatty lipid bilayer is ineffective and the virus can't get inside your cell. So I thought, that science, as they keep understanding it a little bit better, was super interesting. And the other big piece to understand about the virus is that it is likely to mutate. So it's very similar to the flu viruses in that regard, where some good news is that we do believe people get an immune buildup. So they build up antibodies and become immune to this particular strain of COVID-19. So if you or a family member does get infected, the thought is that you will not get sick when infected again or exposed again to the exact strain of COVID-19. But the concern would be, just like the flu, that by next year this time it may mutate and it would be a different type of virus. So it's my opinion, once we get exposed to these, it kind of turns on our immune system. Those of us that are pretty resilient and have been working on our guts and inflammation and eating clean are going to have a lower response, any second or third time around, no matter what. But that brings in the concern about a vaccine. So people are talking about a vaccine coming out. It's going to take about a year, which is wild. And that by the time they get it, this will be a much different type of virus. Like, it'll look completely different. So we'll be chasing it, just like with the flu vaccine, which this past year I think was only 30% effective. I'm not sure that a vaccine is going to be the answer. So we will get back to the point of taking care of yourself and getting your immune system as strong as possible. I also was interviewed yesterday by a local TV station talking about how in the U.S., a lot of people have been kind of freaked out by the fact that there's younger people getting the virus here, and they asked about vaping in teenagers, which I thought was kind of interesting as well. So vaping brings a whole bunch of interesting concepts where, everything from obviously damage to the lung and inflammation to a bunch of toxins that are coming in, and these kids do not understand that they're putting themselves at a much higher risk long term from a lot of different diseases, but COVID-19 for sure. So those are a couple things. If if you have teenage kids, or if you have families and friends that do, spread the word, because a lot more of them are vaping than they will let on. I have a teenage daughter and she does not, but she tells me about a lot of people and friends at school that are doing it. So, right now, especially, anything that causes extra inflammation in the lungs is going to be detrimental if or when you get exposed to the coronavirus. So one other quick point, and then we'll go ahead and end with the affirmation, which is, I also heard that the patients who are ending up in the ER, some of the ER docs are saying the ones who were treated with steroids. So here we are in our busy clinic, and we're getting people calling in with virtual visits who aren't feeling well. And, I'm having to navigate, is this allergies? Is this an asthma flare? Is this, upper respiratory strep or the flu virus? One of the things we tend to prescribe a lot, especially in asthmatics, is a Medrol pack. And many of you may have had that in the past for different reasons. But it is actually suppressing the immune system, and contrary to what you would guess, it's making the COVID-19 presentation more severe. So if you have to call your doctor, if you had a history of asthma, we are going to try to stay away from steroids if at all possible. Okay, so ending with the affirmation for the day. And again, as always, I will continue to do these lives as long as you guys are benefiting and enjoying them. I appreciate questions and ideas for topics that would be beneficial. The affirmation for today is, I can handle any and all challenge that comes my way. Okay, so we're going to have our immune system's going to be ready. We're going to be in the right frame of mind, not fear-based. We're going to be in a place of strength, calm, and resilience. So I can handle any challenge that comes my way. You guys take care. Have a wonderful day, and we will see you here tomorrow.